I'm Dr. Yeko, Timothy Yeko. I'm a board-certified reproductive endocrinologist. At St. Joe's Women's Hospital, it's the premier women's hospital of Tampa. So that's why I'm here. And a few years ago when they started the robotic program, that's when I got started with them. I think there's progressively newer generation robotic equipment that gets better and is evolving. There's very advanced electrical generator systems that attach to the instruments themselves, and those are changing to make it safer. The visibility of the robot, I think, is a huge advance because for the patients that I deal with, infertility patients, you're dealing with very delicate structures, the fallopian tube, the ovary, the uterus, the peritoneal surfaces, and the visibility allows you to really see the surgical planes. And when you're taking out diseased tissue, you're always taking it off of a healthy organ. And so it's very helpful to be able to minimize collateral damage by being able to see very well. And those things have evolved steadily with the robotic procedures. The infertility patients that do require surgery, frequently they have gynecological problems like ovarian cysts. They may have blocked tubes or scar tissue that's affecting their fertility. They can have endometriosis. That's a very common problem that patients with infertility present with. And certainly tumors of the uterus, fibroid uterus is a very common presentation along with their complaint of infertility. Probably the number one surgery that I do is for treatment of fibroids. That's where I felt the robotic instrumentation was far advanced compared to straight laparoscopy. Anybody that you can convert from a big incision to small incisions is the ideal patient for the robot. Well, I've been doing surgery for a little bit over 30 years, and I remember my training in Chicago where these type of surgeries that I do now robotically, those patients would have been hospitalized with a large incision for about a week, and it would take them 4 to 6 weeks to recover. So over time, minimally invasive procedures have become the trend, and it's great to see these patients be able to go home the very same day, be fully recovered in 10 to 14 days. I would choose St. Joseph's Hospital to have my procedure because I think it is the premier women's hospital of Tampa. And they have a very dedicated team of professionals in the robotic surgery suite. And they have high standards for training all the physicians, as well as the nurses, the scrub techs that are involved in those procedures. And it's really a team effort. There's a lot of moving parts in the robotic suite, and it's important to have all those people communicating and being trained to a high level.